Dr. Bregman, 40 years of practicing psychiatry in South Florida. Today, I'm going to talk about a very important topic, and that is dysthymia and how it's linked to alcohol and substance abuse. What is dysthymia? Dysthymia is a chronic depression, a depression that's never ending. So it's prolonged depression. And what we're going to be talking about today is how the coronavirus has triggered the dysthymia so that people are also being involved in substance and alcohol abuse. And it is escalating post-lockdown like we can't believe. So what do we need to know? Well, 1.5% of people 18 and older in the United States have dysthymia, and 3.3 million people are really affected. So this is quite a large number. So when we talk about the link between dysthymia or this chronic depression and alcohol substance abuse, we're talking about the concept of dual diagnosis. It's been more recent times that AA and groups that are helping alcoholics have come to realize that in order to really be successful, you have to treat all the comorbidities of depression and alcohol and how they're linked in substance abuse as well. So it's kind of a never-ending depression. And how do I know I have dysthymia? Okay, in other videos on Depression 101, I went over the SIGI caps, which is a mnemonic for depression. And basically, S stands for lack of sleep or unable to sleep well. I stands for inability to enjoy pleasure. And before we even get to the SIGI caps, we have to have dysphoria. And dysphoria is just lack of pleasure in life. So that's number one. Then we have SIGI caps is sleep, inattentiveness, worrying, guilt, loss of energy, poor concentration span, appetite issues, and even suicide. And that's really can be the culmination of what happens when people are not treated. So what do you need to know? Well, what you really need to know is that it really wreaks havoc on people's lives. Their careers are going downhill, the bosses are on them, they're not functioning well, they'll lose time at work, they're late, they don't get their things done. Their relationships are deteriorating at home, family, friends, and they have no quality of life. So they're just unhappy people. So, and what they do, these individuals, is they escape from their hopelessness by drinking, which stimulates dopamine and gives them some maybe temporary pleasure. But in the long run, it's really a depressant and it causes more anxiety, distress. So this escape into hopelessness, that we see, it for a few happy moments really doesn't work. So what can we do? Well, one of the secrets is that you don't really need rehab. You could go to outpatient programs, go see a psychiatrist. In my practice, I've developed very good treatment planning in terms of managing people with this problem. First, a good assessment always, and see if there's any comorbid illnesses, medical problems, etc., other psychiatric disorders as well. And then come up with a plan that requires possible medication management, the use of antidepressants and other medications, the use of AA as an adjunct and other therapists also, and family supports. So we build a good treatment plan, and compliance to treatment plan is important. Then what we do is there are fabulous medications to help reduce desire. I don't know why many people are not discharged from inpatient and other programs, because they really work and they help desire. They have a minimal amount of side effects. So there is hope. And by following some of the guidelines that I mentioned, just find a practitioner to help you. Try to sign on to my YouTube at BregmanMD Psychiatry. And this will also give you a lot of good tools to help you, go further and find some treatment options.
BregmanMD Medical Group offers online psychiatry and online therapy.